everybody, it's Dr. Paula Kowalski with Kowalski Chiropractic. As most of you know, I am expecting myself, so I'm about 27 weeks pregnant right now, almost to my third trimester. So Dr. Tyler and I are both going to go over a few exercises that are completely safe and awesome during pregnancy, and we're going to break it into first, second, and third trimester. So I'll be going over second and third trimester, and he's going to do the first trimester. Little caveat. As with a lot of other stuff during pregnancy, make sure you're checking with your own OB or midwife, making sure these exercises are okay and tailored for your own self. There's certain conditions during pregnancy you want to avoid some of this stuff with. So just make sure you're checking with them first before you perform any of these. Otherwise, we will go ahead and get started.
Whenever you're ready, go ahead.
Okay. All right, this is a good one for third trimester. So it's another modification of just a regular squat. At this point, it might be a little bit harder to do a regular squat and go down in full range of motion. So you can do like a door assisted. So you can grab hold of the handles, kind of sit back in a good squat, down as far as you can go. Just like that. Okay. This next one is really great for the third trimester as well. These are both really good glute isolated movements to make sure you're activating those glutes nice and properly. Super important during pregnancy to kind of help minimize lower back pain and keep the pelvis nice and strong. So the first one is called a clam, and you can add a little bit of resistance if you like. See how it feels. You want to make sure you're getting good activation through there, so if you need a little bit more resistance, you can add a TheraBand around your legs. So you're going to be on your side here. Legs should be about a 90-degree angle. And you're going to go up nice and slow. It should take you about 3 seconds to come up to the top here. And then about 3 seconds all the way back down for the eccentric contraction as well. And you should be feeling it pretty much right in that buttock area. And then repeat both sides. And then the next one is going to be similar to that, but just bringing that leg outward. So you can bring the leg, go ahead and straighten the leg up and go all the way straight up here. And then both of these movements, making sure you're feeling it in the right places. You shouldn't be feeling it really anywhere else except right in that glute muscle. And that's it. All right, this next one is really great for both pregnancy and then even postpartum. As you know, a lot of the weight kind of shifts and you have a lot more weight through the front. You'll kind of notice your shoulders kind of rolling through the front there. Or when you start carrying your little child or nursing, a lot of those muscles will start to get kind of fatigued and kind of roll in a little bit. So this is really great to kind of help open that up, strengthen out all those back muscles. So you can get a little TheraBand here. You can do a couple different ways. You can put it in your hand here and you can just gonna go straight outward. So you should notice if you're activating it properly, you should feel activation pretty much right through that middle lower back, kind of middle lower trapezius in through there. Just like that. So making sure the shoulders are down and back when you're starting. And then the next thing you can do is actually just bring in the arms completely outward. Just like that. So a couple different ways to do it. Modify it, see what feels better to you, and then making sure you're feeling it in the right proper area back and through the back there. All right, this next exercise is called the slow roller. It's really great for all trimesters. One thing to kind of keep in mind with this one, make sure you're doing your belly breathing and really working on the breathing while you're going through these movements. The other thing is go nice and slow and controlled. You don't want to be going through the movements really quickly. It's better to just take your time, making sure you're getting proper activation through the core. So what you're going to do is you're going to start on your back, just like this. And it kind of starts out in the position of the dead bug. So you're going to get up into this position. So while you're going through those movements, you want to go nice and slow. You want to make sure you're not using your head. Everything should stay kind of exactly how it was in the position of the dead bug. So this goes into a progression where you are on your side, kind of like a side plank. Elbow should be underneath the shoulder here. Knees should be about a 90-degree angle. You want to come up and bring the arm and leg forward like you're kicking a hacky sack. and back down. And then you can even do a few reps of those if you'd like. Same thing, working on that nice, good belly breathing. And then you can do the same thing and going back down in reverse.